And now, I am extremely proud to present Zach Holdsworth, co-founder and CEO of Hint Health. As a direct primary care physician myself, I am focused on providing personalized healthcare. So it was so refreshing to have called the sales team at Hint and to have Zach pick up the phone himself and onboard me as a new Hint customer. To me, he is not only an avid supporter of the whole DPC ecosystem, but he's also somebody who is down to earth and who also strives for personalized care for each and every one of his clients. It goes back to when Zach had a dream to transform healthcare, and when he saw the DPC, he envisioned a solution to the structural issues and envisioned creating something to support the growth and success of the DPC movement. Zach will be joined by his rockstar colleagues, Schulte, Head of Product, and Aimee, Leidich, Director of Business Operations and Data Analytics. Please help me welcome Zach Holdsworth.
Thank you so much. And I just wanted to start out by thanking you so much, Marielle. I think you've been absolutely amazing MC and host for Hint Summit this year. The theme for our talk today is meeting the moment. And to help kind of guide me through a journey of it kind of through our talk, I've got with me our Director of Business Operations and Analytics, who's going to be talking with us a little bit about how this community has met the moment over these trying times over the last couple of years. And really taking us on a journey, leveraging data and analytics to help share that story. Then I'm going to come back, I'm going to spend a little bit of time talking about our role and the way we sort of see our role in helping continue to support this community so that you can continue to meet the moment. And so I'll be actually making some exciting announcements about things that we've been working on and talk through some of the things that we're excited about here at Hint. Then I'm going to be joined by our Head of Product, Alexa, who's going to be talking through looking forward and the things that we are thinking about on a go-forward basis so that we can continue to help this community meet the moment. And so before I jumped into that, I wanted to just spend a little bit of time talking about why we think it's critically important that this community does meet the moment and continues to do so. So as we all know, for the most part, and things have actually been resonated throughout this conference, the insurance fee-for-service infrastructure is used to pay for the majority of payments in the US healthcare system. Not always necessarily through insurance, right? Sometimes you have employers that are essentially renting networks, but the insurance fee-for-service chassis is used to pay for the vast majority of healthcare in the US. And Warren Buffett was famously quoted as saying, this is the tapeworm of the US economy. And I sort of believe that to be true. And so when you start to think through, what are the reasons for this? So at a fundamental level, what's going on here? And so the way I tend to think about it is there's really three key things. And these are themes that I've repeated at a number of other summits. The first is just lack of price transparency. And we've heard a lot about price transparency here during this conference. But obviously having no price transparency is a problem, right? It's pretty obvious, but this is one of the issues. The second is the perverse incentives that are introduced as a result of this infrastructure. And this is really driving the wrong types of behaviors across all of the stakeholders in healthcare, including, unfortunately, doctors who have to operate within the fee-for-service status quo. But it also applies to all of the other stakeholders who have these perverse incentives because of the system they're working within. And then, of course, and we've obviously heard this a bunch as well, but the high administrative overhead. And I think to the tune of hundreds of billions of dollars of waste per year. And so the way we tend to think about direct care, and one of the reasons that we got very excited about direct primary care when we originally started this business is the fact that it's a price transparent model with natural incentive alignment and very little to no administrative overhead. And direct primary care is just this fantastic manifestation of this. We're also seeing this in other sort of virtual first models that are essentially adopting a direct primary care payment model, as well as obviously the kind of growing employer near on-site clinic industry as well, which are sort of moving towards these types of direct contracting based models. And we're really excited about that transition. the way I tend to think about it, and the problem that we're starting to think a lot about at Hint, is how do we go from direct primary care to direct care? And that's one of the things I wanted to spend a little bit of time talking about and sharing the way we think about it from a long-term strategic roadmap at Hint, and the things we're trying to focus on long-term to support this community, taking these concepts of price transparency and incentive alignment and low overhead to other parts of the healthcare system. So the way I tend to think about it is, at the end of the day, what we're trying to do here is build this interconnected ecosystem that's able to collectively outperform healthcare's insurance-led status quo. And so phase one for Hint, and the thing we've really been focused on for the vast majority of the life cycle of this company, is ensuring the success of direct primary care. So we're going to be sharing a few things that we're working on a little bit later to help do that. But everything we've been focused on so far at Hint has been around how can we ensure the success of this movement. The next phase here, and something we've started to work on a little bit more recently over the last few years, is what are things that we can do to help unlock demand for direct care. And we've heard this from folks like Adam and Dave Chase and others in the room that these direct primary care models, when implemented, can unlock savings for buyers, right? And at the same time, obviously improve satisfaction for the patients and improve the lifestyle of the doctor. And of course, in return for that, these larger purchases are actually able to help scale the movement. And we've actually got some interesting data about that, which we'll talk about a little bit later on as well. But then the third piece here is integrate downstream care. It's, as we know, the majority of healthcare spend isn't primary care. 5 to 10% of healthcare, we think it should be more, right? But the reality is the primary care is just is not the majority of spend in healthcare. So in order to take these concepts of price transparency and incentive alignment, low overhead to other parts of the system, we need to start integrating downstream care. And that's something that Alexa will spend a little bit more time talking about in her session. But this is the way we tend to think about our strategy as a company. And of course, as you're able to integrate these price transparent cash-based models for services that fall outside the four walls of primary care, which we're seeing a lot of already in this community, it obviously amplifies the impact of that core DPC offering. And also it helps therefore grow the ROI for either the individual patient or the purchaser, if let's say it's an employer. So this is the way we think about the strategic plan. And what I wanted to do is just kind of talk a little bit about how we see really the vision for Hint long term, which is really to redesign the healthcare system to enable easy access to high quality, affordable care. So the way we tend to think about it is, if we can achieve all of these things over time, what we end up with is an ecosystem of transparently priced direct pay relationships grounded in this foundation of affordable primary care. And so if we sort of hark back to that circle with lots and lots of, with all insurance, we think insurance has a role to play, right? But it shouldn't be the mechanism with which 60, 70, 80% of healthcare is paid for. So the idea is you can move the common predictable care out from under the insurance umbrella. And Senator Frist, I thought, gave really great examples of this. And just leaving unpredictable, high impact incidents in the insurance arena. So this is the end state vision we have at Hint for how we think we can redesign the healthcare system and help do so to enable easy access to high quality, affordable care. So I now wanted to hand off to Aimee, who's our Director of Business Operations and Analytics at Hint, who's going to be talking through the ways with which this community has been meeting the movement during these trying times over the last year, 12 to 18 months. Over to you, Aimee.
Thank you. I'm sure you all are aware that starting in March 2020, everyone's life across the globe was forever altered by COVID-19. The pandemic hit us all personally and professionally, and I would say no one met this moment more than the millions of healthcare professionals who are still years later battling COVID to keep the rest of us healthy and safe. What follows uses data from the Hint Health database to demonstrate how direct primary care specifically was able to continue to care for their patients during this very unprecedented time of need. A recurring theme throughout Hint Summit has been the resilience of direct care, which I'm sure you have heard. In this face of an unimaginable, very enduring tragedy, DPC practices have been able to withstand the uncertainty and income shock experienced by other models of care. Take a look at this visual here on the right. The x-axis that's going across the bottom shows the week in the year 2020. Week 10 is the first week of March, which holds significance in our lives as the final few days before the pandemic and serves as the baseline for this presentation. The y-axis, which is going up and down, this is the percent change from this baseline week to other weeks in 2020. The red line that you see on this chart is from researchers at Harvard University and Frisia, which is a healthcare technology company, analyzing data on outpatient visits for more than 50,000 providers nationwide. That steep drop you see at week 11 is showing that outpatient visits dropped over 60% compared to visits before the pandemic. These visits did recover, you see the line comes back up, so that by the end of 2020, outpatient visits returned to 0% change, meaning there are about the same number of outpatient visits in December 2020 compared to the before times. Over the course of the year, adult primary care visits specifically declined by 10%. In contrast, you see on this chart a blue line. The blue line uses data from Hint to show the number of active DPC members. Over the course of 2020, patients continued to enroll in DPC, so that by the end of the year, active members had increased by 21% compared to before the pandemic. A similar trend can be seen at the state level. The maps that you see here on the right show the growth rate from the before times compared to the mid-year study period ending June 16th, 2020. Figure 2A, which is the map on the top, uses Hint data to show that all but 9 states experienced positive growth, meaning most US states had more active DPC members in June 2020 compared to before the pandemic. The darker green color represents a larger positive increase. The 3 states with the highest growth in DPC members, meaning the darkest green color on that map, are Iowa with 35% growth, Texas with 18%, and South Carolina with 17%. Figure 2B, the lower map, was published in JAMA Internal Medicine in November and looks at outpatient visits among 16 million Medicare Advantage or commercial insurance holders. Here we see that all 50 states experienced a decline in fee-for-service outpatient visits in June compared to before the pandemic. Now, if we look at different types of memberships, we've also noticed an increase in employer-supported DPC, also something that's been talked about a lot throughout this conference. For many of us, the arrival of the pandemic meant our style of work changed almost overnight. And with this dramatic shift, employers wanted to bring comfort, support, and good health to their employees. And they did this by adding DPC to their benefits packages. Figure 3 here is Hint data showing the percent change in active memberships among employer-sponsored DPC members, which is the red line, compared to retail or non-employer-sponsored members, which is that blue line. While both grew significantly, you can see both lines are going up, you can see that the red line outpaced the blue line. The red line is steeper. The number of employer-supported members was 43% higher in September 2022, so just last month, if we compare that to prior to COVID, whereas retail memberships, it did grow, but it was 26% higher. Shifting gears away from membership growth, we also see that direct practices were very well equipped to meet the need for virtual care. By design, direct care practices decide independently how they deliver care without needing to rely on insurance reimbursement. As a result, DPCs either already had virtual services enabled at the start of the pandemic or could quickly add and sustain them. Figure 4 in blue here uses Hint data to show the percent change in the number of practices providing virtual services. You can see there was a steep increase around that week 12, and this increase was sustained throughout the year, representing a 144% increase in virtual services at the end of 2020 compared to prior to the pandemic. Figure 5, in red, uses aphasia data to show that virtual outpatient visits did increase right after the start of the pandemic at that same week 12 area, but then they decreased around week 20, which would be about June 2020, and have stayed around 7% higher than prior to the pandemic. As you can see, not the same availability for virtual services, despite being a really important way for patients to access care when they felt unsafe going into a hospital or a doctor's office. Now, beyond just the first year of the pandemic, direct care has been able to continue to provide virtual services at pace with the need for primary care. Figure 6 in blue on top is a figure that I'm sure you all are very familiar with by now. This is from the New York Times and shows the number of new COVID cases by day since the start of the pandemic. We can see the peak around the holidays last year, and then this most recent peak again in the fall. What you're probably less familiar with is figure 7, which is in red below. This is the number of virtual charges on Hint over the same period. So as cases go up, DPC providers have had the flexibility and aptitude to meet the moment, be it caring for a patient virtually from their home or supporting businesses and offering their employees some much needed care. For all of you out there working on the front lines who have truly met this moment, thank you for keeping us all afloat. From here, I'm going to pass the mic back to Zach, who will talk through the ways in which Hint has contributed to this moment.
Thanks so much, Aimee. And that last chart always kind of shocks me whenever I look at it, because it's just sort of so amazing at how responsive this community is to shocks to the system, which is really important for, I think, a healthcare system to be able to have that capability. So what I want to do now is actually just spend a little bit of time taking you on a journey. I'll be leveraging some data that we have and some other insights. First thing I just wanted to do is show you, we just got off with our head of data analytics, and this actually work her team has done, whereby we can actually see here the real-time data from our core application. It was updated an hour ago. And what this does is this shows our client locations across the country. And you can see it's really interesting just to see kind of different hotspots and kind of where there is direct care and not. But I think that the reason I want to share this data is just to show the breadth of this movement and how it's continued to scale really well over the years. In addition to that, it's also, I was digging around a little bit to try to find insights to kind of how people have been interacting with Hint. So there's a few different kind of stats I just pulled up. Total active Hint users has been growing, obviously. Perhaps more importantly, those monthly active users. So I thought it was quite interesting just to see this. You can see the number of minutes per month spent on Hint, about 40,000 minutes per month, which I thought was pretty cool. And the number of sessions you'll see here is about 130,000 sessions. So that's times people have logged into the application. The thing that I thought was interesting about this is you actually see the kind of the average dropping, which funnily enough is actually something you want to see, right? We want to see our customers like not needing to log into Hint. But perhaps more interestingly, even than that, when I started to look at kind of transaction volume across the platform, we're sitting at about $500 million a year going through the Hint platform on behalf of our community, which I thought was like a pretty good milestone. I thought it was really exciting to see that. What's interesting though is if you look at the total transaction volume all time, it's about $1.4 billion. And so what that shows is that because we've been around for 8 years or so, what that really shows is an acceleration of growth in terms of folks coming into this community and purchasing this type of care model. So I thought that was a really interesting data point to share. The other thing I was going to share, this is something we spent a little bit of time going over at last year's Hint Summit, was this a data visualization that kind of shows the growth, just using this actually called a force-directed graph. And so we can go back in time all the way to, I call it Dr. Zero, right? Who's Dr. Rob Lambert's here. So you can see Dr. Zero. We come back all the way through to 2016. And what you'll notice here is that the majority of our customers in the early days were sort of the small independent clinics, maybe with a few employers, maybe with a few locations. The light blue dots would be locations, but for the most part, it's that small independent clinic. And kind of going back to that first part of our strategic vision at Hint around ensuring the success of direct primary care, one of the initiatives I've been really excited to kind of talk about here is our DPC Accelerator program, which is something that we have been sort of working on for the last year or so, but really launched in earnest in April. And since then, DPC Accelerator there's been about 45 workshops. There's about 250 students have been involved. And I really want to see that number grow because I think it's just such an amazing asset. And there's about 300 hours of content that's been consumed. We've also been working on a DPC playbook to help new practices get into the movement. And this is something that has been led by our team, along with Lauren Tancredi, who, if you were here on day one, you would have got to see some of her great content there as well. But I wanted to share, I'd asked my team, is there some testimonial I could share? And I thought this was a really powerful testimony. So I just wanted to share this just to get other folks perhaps interested in this offering that we have, because I think it's really valuable.
Hello there, I am Alicia Logan and I am the owner of Logos Health in Gastonia, North Carolina. We are a direct primary care family practice and we just opened our doors in August of 2021. So I was super excited when I did my research and I opted to use Hint for my member management and billing. I had no idea that I was going to have access to all of the resources available in the DPC Accelerator. You know, I came from a traditional hospital-based employer, and so they did everything. There was someone to do marketing, there was someone to do billing, there was someone to do member outreach. I didn't have to mess with any of that. And so when I found myself with a knowledge deficit, I was like, oh my goodness, I don't know where to go. And so I quickly learned that the DPC Accelerator was a phenomenal resource. In fact, early on, if I had a issue or a question, that's the first place I would go to, and I would typically find there would be some recorded session for me to review. And I even started assigning them to my front office support, and so it was almost like a free training. I would assign her a few modules to review, and she would look at those, and we would typically figure out how to get it done. And so can I tell you what an asset that is? I mean, I would look for consultant services thinking that maybe I could find answers there, and they would charge an outrageous fee for the same information that Hint was giving me for free. Yes, for free. So I am here for it. I will tell you, it has been a phenomenal asset to my clinic. Even with growth, I implemented some of the strategies and we are growing leaps and bounds. And so I am a huge fan of Hint and the DPC Accelerator. I would encourage any DPC practice, if you're kind of going back and forth about products and which one to opt for, I think the value add for the DPC Accelerator is reason alone to go with Hint. So I'm super excited, and Hint for the win. Okay, take care.
Thank you so much, Alicia. I just love hearing things like that. And as I mentioned, I'd really love just to encourage folks that are, especially who are getting started, to get involved with the DPC Accelerator and really lean on our team to help support you in your growth and success. Moving on a little bit here, I wanted to kind of start to fast forward. If we go back to this network map here at Hint, what you'll notice is as we continue to evolve here, what you'll start to see as we go through time, you'll start to see an increase in, obviously those independent clinics continue to increase there, but we also start to see a much larger increase in the number of employers that are coming into the space. So this is something that I think is really cool to see. You can see those red dots are kind of scaling out, and there's more and more there. Part of the reason I want to share this is because one of the things we're also seeing in addition to that, historically, the majority of sort of members on the Hint platform were retail, right? And that's, of course, where we started and a lot of folks in our community started. But what we've started to see is that increase in employers who are starting to come to the table and say, you know what, this is a really good benefit for our employees who want to support this community and be part of this movement. And so over time, you'll see that number of employee-sponsored lives on Hint has increased to the point where it's about 50-50 now. And our anticipation is that, of course, the entire number grows, but our anticipation is employers are going to continue to adopt DPC. And you can see that here as well. This is just the number of employers, not employees, that have been onboarded onto Hint for management through Hint. One of the data points here that is really interesting is as those employer groups have started to come on board at larger and larger scale, the number of rows of upload data that have been uploaded into our enrollment platform is pretty astounding. It's about 1.7 million rows of data are being uploaded per month because we're keeping that data in sync. And so that's been one of the things that's really driven us to and really invest in our what we call our employer engine and our infrastructure to support direct care practices that are working with employers. So, for example, one of the products that we've spent a year or so building out is eligibility autosync, which we actually launched about a couple of months ago more publicly. And this basically is designed to automate the ingestion of all that data in a way that is pretty seamless. And there's actually a service that sits behind it as well to deal with errors and things like that. So your team can kind of focus on what you want to focus on versus handling these operational overhead items. So this is one of the items that we've been investing in. There's others that you'll hear about from Alexa as well, I'm really excited about, that are coming online as a result of feedback from our community who continues to evolve and grow over time. So kudos to all those folks who are out there and successfully kind of both maintaining their low churn in their retail populations, while also starting to figure out how can you bring these additional purchases into the mix. Now, if we go back to this map and continue this sort of journey through time, what you're going to notice here is obviously that increase in employers and clinics, but you'll start to notice there are network connections that are forming. So as was mentioned, I think in one of our talks earlier on, Hint has built out and supports a growing number of direct primary care networks, like Nextera Healthcare, like Strata, like Primary Health Partners, and Tampa Bay Direct Care Network, and a number of other groups that are all sort of running their networks on Hint. So what the idea here is what we started to see is this really interesting pattern emerging where this infrastructure existing, we would have a client export data from Hint, email it to someone else who would then input it into Hint because they had an affiliate relationship in place. And we thought, okay, that doesn't make a lot of sense. Why don't we kind of build out this infrastructure to support those workflows? So over time, we've been you sort of zoom in here, more and more connections have been forming. And you can see, this ecosystem is really starting to thrive. And if we go through to sort of the end state, this is the latest cut of data was from a couple of days ago. And you can see a lot more connections forming here across the ecosystem. So really interesting to see. And part of the reason I share this journey is one of the things that we've been working on at Hint is as we've always sort of been seeking ways to facilitate introductions and create connections within our community. And things like Hint Summit's an example of that. Our accelerator, we often make connections there. We also work really closely with a lot of the networks that are running on Hint to connect them to other groups. And the vision has always been around sort of continue to help this community grow and thrive. Historically, though, this has been somewhat of a manual and tedious process, right? We have our network development team that often does manual lookups for folks. We've got our affiliates pool where you can come in and actually register interest if you want to work with other people. And so we were seeking ways to figure out how can we scale this. And so Hint Connect is a product we're really excited to be announcing. The intention of Hint Connect is it's really designed to further enable connectivity within our ecosystem. So that our clients and our community can continue to thrive together. And so if you join Hint Connect, the idea is we'll make it really easy to get plugged into other provider-led networks, as well as really innovative health plans and sort of captives and groups that want to integrate direct care. We're going to make it a lot easier for those entities to come in and contract with you in a way that is more scalable. So excited about Hint Connect, and sort of you can see some announcements coming out over the next couple of quarters, but we're launching in Texas and this year, and we'll be trying to take it nationwide next year. So that's the kind of the final piece here in terms of my part of this talk. I just wanted to finish by saying I'm really excited about all the things that you as a community are doing to continue to meet the moment, and we're really excited to be on this journey with you. So now I wanted to hand off to Alexa, who's going to be talking about kind of looking forward. What are the things that we're thinking about on a go-forward basis, and how can this community continue to meet the moment, and what are the things we're doing to help support that? So over to you, Alexa.
Thanks, Zach. So I thought we could take a minute before we dive into the specifics to talk a little bit about how we think about those 3 strategic pillars that Zach spoke about earlier in the context of building product. So starting at the top with ensuring DPC success, it all comes back to the patient experience, as you heard reinforced in, I think, almost every session in the last day and a half. Happy patients drive a happy DPC business. So we like to think about seamless patient experiences to ensure that technology never gets in the way of that relationship. Moving counterclockwise to unlocking demand for direct care. Working with demand-side entities like employers often brings a new layer of complexity and sometimes operational overhead that you might not have dealt with in the past. So we like to think about automating at scale and kind of helping with that connectivity so that you can stay focused on delivering value to those new clients of yours. And lastly, integrate downstream care. DPC value extends far beyond the bounds of primary care. By doing things like working with like-minded specialists in your community or negotiating cash pay rates with the lab down the street, you're pushing your value all the way across the care continuum. And we want to look outside the walls of your DPC office to help you facilitate those connections with things like Hint Connect that Zach just mentioned. So without further ado, let's dive into some specifics. First impressions are super hard to beat. So that's why we've spent the last year reimagining from first principles our online sign-up workflow. What you see on the screen here is what I hope is an apparent before of our provider selection screen. And what you see now is the new version of our provider selection screen. We focused on a cleaner, more modern feel that really helps the patient navigate to make sure that they're choosing the best combination of benefit, provider, and price point through a couple of easy steps. Now, let's say that your patient, doorbell rings, dog starts barking, life happens, and they lose track of sign up halfway through. In the near future, Hint will actually take that information that they've entered on their sign up form and create a new prospective member for you to be able to manage their sign up process. With an eye towards integrating with your favorite marketing automation tool and patient communication apps, this gives you a central location to manage those notes, notification schedule, and kind of that whole stage process of turning them into a member at your practice, ending with easy enrollment right inside of HintOS. Now, once your patient has actually signed up with the practice, they'll have access to our recently finished passwordless patient portal. This means that when a patient wants to get a copy of a past invoice, they need a new link to pay their current invoice, they can actually come in here and do that without having to contact your front desk. Let's say your patient moves. Usually they'd have to call you, tell you new address, new phone number, got to update that in a couple different systems. Now the patient will be able to come in and do that on their own, and it will flow out to all of your integrated systems automatically. Next up, let's say new credit card. New expiration date, new security code. Again, most of the time they'd be calling your front desk to try to get them to update that credit card information. Now they'll be able to come into their portal and proactively manage that and set it as their new default payment method. If they ever have questions about their membership, maybe how long they've been with your practice, when their next upcoming bill is due, or did they remember to add their kid to that membership? Again, no longer need to call you. They can come in and see those details right in their patient portal. And lastly, when it comes to documents and agreements, if you ever have a new policy that you need to roll out or a patient wants to be able to print a copy of that agreement, they'll be able to do so all on their own. And now, virtual drum roll, please, for all of you Hint clients in the audience. Zach spoiled it just a little bit. You'll be getting this patient portal starting next week. So keep an eye on your inbox on Monday for all of the important details. So what have we done so far? Your patients have signed up, they're engaged, but now it's really time to focus on that value that you're bringing to the table. So what you see here is an invoice that represents probably a pretty down the middle DPC membership. We have an included office visit and a lab that's been knocked down to an easy $5. Most of the time when the patients check out, they're probably paying you something between $0 or maybe $5 or $10. That's a really awesome experience for them, but can make it really easy for them to miss the value of what they're really getting out of that office visit. I was chatting with one of our clients recently, and she told me a story that I would love to share with you. So she's been trying to expand her DPC business with local small businesses in her area. And it just so happens that 2 of her patients are actually benefit advisors to that local community. They love her as their DPC, they love DPC as a model, and they'd love to get this model in front of their own clients, those local small businesses. Should be a pretty easy fit. But what they've really struggled with is a lack of quantitative data to be able to describe to those small businesses what's the value they're getting to that membership. And it dawned on me that something as simple as showing a list price or summarized savings banner on an invoice might really help them describe that value to those businesses. So what we can see on the screen here is that that patient saved $7 on their lab and $100 on the office visit. And we see down at the bottom, that's all wrapped up with a nice little $107 savings ribbon. Now, I'll admit, I don't really remember the last time I got something for free, but I can absolutely tell you the last time I saved $100 in one visit. Moving forward, we didn't just stop with included services or flat rate overrides. Our advanced plan administration tool enables you to meet any layer of complexity, whether that requires you to offer price limitations, discounts, surcharges, or even time-based tracking. So let's say that you need to throw in 2 PT visits a year to a membership to be able to land that next big employer. Not only will Hint track that for you, but we'll roll up that utilization and savings and show it to your employer with every invoice they get. And if they use more than 2, we'll even charge it to them. This is actually live in beta testing. We're really looking forward to learning more about getting this rolled out. We've covered a lot of what happens inside the walls of DPC. So now let's start to take a look outside. Your patient calls in and they need an imaging study. You go into HintOS and you're able to see from that advanced plan administration we just talked about that if they go to Sunrise Imaging, the x-ray will actually be free. And this is because you've worked with Sunrise Imaging and said, you know what, I'll pay you on the back end. I don't want my patient to have to worry about this. Now we'll pause here for just a second to think about what happens today. It might get a little bit messy. Maybe the imaging center is tracking this on a spreadsheet. Maybe you email them and say, hey, Alexa's coming in. Don't forget, she doesn't owe you any money. And I hope I get there before that sticky note falls off their monitor saying that I don't owe them anything. In a future world, that imaging center will be able to see my information, including those coverage details that I don't owe anything before I arrive. And once that imaging study is wrapped up, Hint will automatically pay them from my DPC's account into theirs so that we can all kind of wrap up and call it a day nicely. Now we've covered a lot today, but if there's one thing I hope you can walk away with, it's a sense that we're here for you. Whether it takes reimagining our online sign-up workflows from first principles, creating an advanced plan administration system, or using Hint Connect to find those imaging facilities that are worth negotiating with. We're here to always make sure that you're ready to meet the next moment. Back to you, Zach.
Thank you so much, Alexa and Aimee. That concludes our talk today. To have any Q&A. So Marielle, do you want to jump in here?
Yes, absolutely. So while we're working on the visual, the first question that has come through the audience is, Hint clearly has access to a lot of useful data like Aimee showed. Does Hint plan to share this type of data more widely to help increase awareness of direct care's value?
Yes, this is Aimee. I could jump in and answer that. We historically, so we've had a pretty robust analytics infrastructure in place for roughly 3 years, and we've been using it for internal analyses. So how do we make our business better? And recently, in the last few months, we've started working with marketing and a PR firm to try to package this information and share it out more widely. So I'd say we sort of laid some groundwork to make sure we had the right information, that it was people could trust it. We wanted to be, we can be a resource for trustful information. But yes, the goal is in the coming weeks, months, this will start to be going out to the masses in various forms.
Wonderful. And this next question is for Zach. Does HINT support specialists or downstream providers too? Because one of the follow-up questions to that is, do you see the growth in direct care occurring outside of primary care?
Yeah, so we support some specialists today. I would say it hasn't historically been our focus. I'm a big believer in focus, and we've been really focusing on the DPC community and primary care. That being said, we do have some specialist groups that are working with us and we support them. However, what I wanted to say is we are increasingly looking to support specialists, but I'd say with a bit of a bent to the angle that we'll want to be doing so in a way that is integrated with our core community of DPC doctors. Right? The idea is that we want to build out this ecosystem from primary care out. So looking at innovative ways we can help integrate other specialists into this community, so that you don't end up with another sort of disjointed system. And that's something we're going to be focusing on actually in 2022. Alexa, would you add anything to that?
No, I think that covers it pretty well.
Wonderful. The next question is, you definitely demonstrated in your presentation the power of HINT, and that HINT allows us to track data as HINT clients. And that helps build legitimacy to our practices. So what are other pieces of data that individual practices or practices that have multiple providers can track to help bring legitimacy to their local communities and present at things like Chamber of Commerce meetings, for example?
So I thought, I'll maybe perhaps make a comment, and then Aimee, if you want to jump in. There's been a few really great talks. I don't want to sort of defer the answer, but there's been a few really great talks at Summit specifically about this. And I think the conversation that Jeremy van der Knijk had, I think it's worth revisiting that. There's some real gems in there. Adam Russo talked about just like the different types of data that are important to employers. And I think, it's not actually an area of my expertise, but there's a bunch of people in this conference where it is an area of expertise for them. And so I really encourage you to go and look at those talks. Aimee, would you add any other additional data points here? Because I know this is an area you think a lot about.
Yeah, I would say as far as DPC as a whole, like I mentioned, we are starting to turn externally to share this information out. We have on our website, we have an About DPC that now has 3 pieces of information on it. And we are working actively right now to update that, so it can become a resource for you to refer to see, general trends in DPC. And then that information, obviously it's on our website, and then can be shared elsewhere. Also, like I mentioned, we're working with a PR firm to start to kind of publicize a lot of these findings and just different things about HINT. And that's when we say about HINT, a lot of it will be about DPC in general. And so when you see that, you can share it, like it, do all the things on social media, but we would like those to also be a resource for other people to be able to take to their other meetings, share that information more widely to help us all validate this cause.
Wonderful. Now, after this inspirational 2 days, what is one challenge that you guys would have for HINT Summit attendees after the summit concludes?
Alexa.
Say no, Scott.
I won't jump in. So I think part of the reason I'm freezing is there's a lot of challenges. And I think that's a good thing, right? We're trying to summit a mountain here, right? If you're on board with our vision of redesigning healthcare to make it, affordable and accessible to everyone, then we've got a long road ahead of us. And so I think it's important that we continue to just stay focused on the end goal here. So one, and I think maybe the point I'm going to make is that it's going to be hard, but it's going to be worth it.
And
Awesome.
I think I can just going to add a brief comment just from the product side. Our ask is always just stay engaged. We can only help you fix or build for things that we know about. So engaging with us, staying patient with us, working with us, we're here as your partners. And that's really, really the best that we can do with you.
Great. And now zooming out, not necessarily focusing on the challenges, but the wins that have been achieved in the DPC movement. Zach, I want to point out that you've built a company from scratch, as many direct care practices are doing and have already done. So are there any broader observations or advice you'd share that could be helpful?
Yeah, I think one of the things, my team will all be laughing at me because this is something I really struggle with myself as a leader. But I think one of the most important things about business and building a business is making sure that you really clearly articulate your end state, your end vision, and your goals. But do so in a way that allows you to focus on a small number of things at any moment of time so you can get to it. I think what often people gravitate towards is trying to scorch the earth and try to do everything. And often what you end up with is an unfocused strategy that doesn't allow you to succeed at the small number of things that you could be succeeding at in this moment. So really it's make sure you understand your end vision, but then carve your strategy back, whether it's a small independent clinic or a big, large-scale venture-backed group, carve it back to the small number of critical things you need to do now to ensure the success of that long-term vision, and try to not be distracted by shiny objects. And my team's going to all be laughing at me because they need to hold me accountable to that, because I personally struggle with that myself because I like shiny objects.
Awesome. And to finish the Q&A, the question that we keep seeing is, will our next Hint Summit be in person?
Yes, and our goal with the prior virtual Hint Summit last year was actually to be in Denver. And so our plan is next year is to host the in-person Hint Summit in Denver. And we're actually going to be renting out Red Rocks for the after party. So if you know what Red Rocks is, it's going to be epic. So that's the goal right now. We haven't actually planned it yet because we haven't got through this one. But next one will be, watch the space. We're really excited about next year's Hint Summit, and will be, if the world permits, it will be in person.
Amazing. Thank you so much.
Great. So am I going to go roll right now into closing remarks? Yeah. So shall I go? With closing remarks? Yeah, cool. All right. Sorry, team. So yeah, so I've been taking a bunch of notes over the last couple of days. And I think this is actually one of the hardest things that I think I will have had to have done all year, which is try to summarize some of the key themes and takeaways from this conference. So on day one, I always love hearing Dave Chase speak, right? He talked about, in his poetic words, right? Dave's a real poet in my perspective. It's important that we keep healthcare local, independent, and open, right? And that as a community, right, we need to work together as a chorus that has a melody, right? So I think really resonated to me that statement. And our foe is the status quo system, right? That's who we are trying to disrupt, right? So that we can bring something new about. And I really enjoyed hearing Clint Flanagan at Nextera talk about how he's had a lot of success with finding mavens within his community to help spread the word. I think this is the way Hint grows. It's the way a lot of early businesses grow. Is you got to figure out who are your champions and go and make those champions successful, and they'll make you successful. He also gave some really good tips and takeaways on 2 questions he asks. Right? Are you happy with your healthcare and your spend? And of course, for the most part, if you ask, if within the context of an employee group, for the most part, the answer to those two questions is probably not yes. And so that's a really great, from my perspective, a really great opening sales technique to kind of open the door to how can we improve these things. Then I really enjoyed hearing Lauren Tancredi and Paul Thomas talking about sort of in the DPC Accelerator tracks, and Dr. Paul kind of sharing his wisdom about how to be a marketing and sort of a PR pro and how to get the word out. And I loved his message about you need to be consistent and authentic and genuine and sincere, right? Like if you can be those things, and then you're not trying to create content, you're trying to document the amazing things you're doing, right? So if you can take those four pieces and focus on documenting, not creating, and then sharing your story, that'll resonate with your community, especially if it's authentic. And I loved how he closed, where he sort of closed out talking about how it's really your obligation, right, to make your community aware of what you do. It's a hint to see that it is our obligation, right, to share, for people to know what we do, because we believe that we can help transform your business. And I think that's the same kind of way you should be thinking about what you're doing, is it's your obligation to get people into what you're doing and to get the word out. I loved hearing Lauren talk through navigating sales uncertainty. Just be you, right? Don't try to be, I've actually met some really nice used car salesmen, so I don't want to kind of be too mean to them, but you don't want to be considered a used car salesman, right? So you need to be likable. And being likable is the gateway to connection. So smile, right? Be kind, be enthusiastic, invest in yourself, and then actively listen. And in doing that, being curious allows you to solve the problems, right? Help people with what they want rather than what is your pitch, right? You're not trying to pitch your thing, you're trying to solve someone else's problem. And I think that's a really critical a part of being an effective salesperson. And so it was kind of a nugget there from Ryan from Northwind about how your praxis should become the nexus of care, right? Especially as it relates to pharmacy and other referrals that you'll be making. So make sure that you're able, become that nexus of care. Then it was I really enjoyed hearing our head of IT security, Avu Dang, talk about how, and actually I was surprised by this, healthcare is, small businesses are equally likely to be targeted as large ones, right? And if in any case, with automation, actually, you may be more of a target, right? Because with automation, if you have lower bars in terms of your security awareness, you may be an easier target at scale. So don't sort of rest on your laurels there. And of course, if anyone ever has any questions about, I might get in trouble right now about security, ask us, and we'll see if Udang can help you think it through a little bit. Then, my favorite meme artist, Sharad from Acute, talked about know your values and your goals, right? And know what you're worth, right? Don't give away what you do for free. Except maybe within the context of healthcare, I love seeing on the occasional kind of scholarship to folks that can't afford it. But besides that, if you're selling to employers, right, if you're trying to go to market with a product, make sure you know your worth and you're confident about what it is you're delivering. And then we went in and we're still on day one, by the way. So such great content with Dr. Delicia Haynes. Begin with why, right? Don't be humble. Tell people why you're awesome, right? We all have a story. Give them your story, but make sure that you're vulnerable and share both sides of your story so that people can connect with you on both the peaks and the valleys. I think this is a really important kind of underappreciated point, is that people don't always want to see the picture of perfection. They want to understand that you're human, and especially within the context of care delivery, if you're able to connect on that human level, people will come to you. Another nugget I thought was really interesting from her story was just around how she found her niche, right, with depression and people with depression. And that was a really great, and that was her passion because of her personal experience. And I think to the extent we're able to connect your story to your mission, to your community, and being authentic and about what you do, I think that's a really great way to build a sustainable long-term business. And then we had Dr. Adam Wheeler, who's who's always has insights. Whenever I talk to Adam, he's always got an insight, as do a lot of folks in our community. But one of the things that kind of jumped out for me was how with employers, you need to find folks who have an appetite for innovation, right? We're still in the early adopter innovator phase of this movement, right? You're not going to get the laggards, right? Well, you will eventually. But what you need to do is find the folks that are more likely to be in a position to move towards something like this. And so that's a really important, a point. He also made the point that no one got fired for hiring IBM, and it's the same with Anthem. And I'd actually just make maybe an addendum to that point, because my view is that today, if my head of IT hired IBM for our infrastructure, I might actually consider firing that person. That's just not the right thing to do in today's day and age. And I think that and I'm exaggerating a little bit, but the point I'm making is that I think we're coming into a world where actually you might get fired if you work with status quo, right? If you work with the big four without thinking through other alternatives. And I think that's a really important thing as a community for us to lean into. And so another kind of nugget he shared, simplify the message instead of trying to educate people about DPC. Can we just reframe it as this is a better way to provide healthcare and it's more affordable? So really figuring out what are the things that allow a purchaser to understand that value. Then, of course, we went and had some really great nuggets from Jerry Vankenif, from Proactive MD, who's impressively the first and only validated organization that's been demonstrated by the Validation Institute, which I think is really cool. The point he made is around start with the end in mind, right? And work backwards from that to the actions you need to take now to achieve those changes. And he was talking within the context of proving value and to an employer, but start with the end in mind and work your way through. Become that trusted advisor, commit to integrity, right? Don't torch the data. It's not worth it, right? It can be easy for a data scientist to lie. And I'll attest, Aimee is excellent on this point in her team. They won't, every time I ask for something, and they won't let me change it. Will you, Aimee? So I don't ask anymore. But, commit to integrity and transparency. Play the devil's advocate and then advertise your success, right? Promote your success if you've gone through those hard, and of course, never compromise your core values and your core model. Another really interesting point came out of the Dr. Flanagan and Dr. Bessiner's talk around physician advisor partnerships. One of the really things that resonated for me is you look the largest employers, the top 5 healthcare priorities in 2021, right? DPC achieves all of them, right? Direct care achieves all of these top priorities. So that's a really powerful takeaway. Bunch of other insights there. So we're still kind of just on day one. And so I'm worried I'm going to get in trouble for going on and on here, but there's just so much great content. Marsha Allen here, Pulitzer Prize finalist, he talks about 4 reasons why healthcare is right for disruption. I recommend his book. The third reason resonated for me, right? The healthcare system is squandering our money. DPC is really well equipped to take on these problems. We can fight back and win, right? So that's the insurance fee for service status quo. We can fight back and win. It's just we need to do it in a way that's unified. And he just gave great example of some really interesting sort of unjustifiable bills that perpetuate the cruelty within the existing system, right? And I thought it was great to make that really real. So lots of great stuff on day one. Day 2, it's always great to hear from Jay today. It was sort of reminded me, DPC was the first reference in the Affordable Care Act in 2010. Right, that's a long time. We've been around for 10, 11 years. So that's just when the act was passed. There's been a movement that predates that as well, with a lot of folks, and I really appreciate your testimonial, Garrison, and a lot of folks like you out there been pushing for a lot longer than 10 years. But as we step forward and we come to today, 33 states have passed DPC-specific laws. That's amazing. Like, to me, passing one law seems impossible. So 33, amazing, great work. And, you know, even CMS is starting to say, you know what, maybe these guys are, this community is onto something with the direct contracting program. We heard from the Pearl Health team. You know, and I'm not going to try to steal Jen back because we've got Alexa, who's amazing as well. So that comment, I thought was a fun comment. So continue. You know, so I think maybe a key takeaway from Jay's talk was figure out ways to continue to push the Primary Care Enhancement Act. I think that's a really important milestone that we can all kind of get behind. You know, Adam Russo, you know, it's all about changing behavior. Employees need to have, and the employee needs to have skin in the game. And the thing I think was interesting about this is how he kind of referenced how DPC providers can refer and help guide patients to many of the services, and that sort of in a way enable them to change their behavior based on kind of transparent costs and also the, you know, the quality of those services. So it was great to hear, and also just the scale of the operation that he's kind of looking to bring to DPC. And we're actually excited to partner with Adam to help connect FEAR Group into our community and our ecosystem, so that he's able to take DPC to more employers and others like it. And then I really loved hearing from Senator Bill Frist, the future of US healthcare. You know, it's the first point of contact with the health system, right? Deep and careful listening to the patient, just as you would your own family member, right? You know, I've always loved the analogy of it's having DPC is like having a family member, a doctor in your family, right? And I think that's a really important takeaway. You know, he sort of resonated some of the points I made in my talk, where it's like true insurance is really for high consequence, low probability events. While within the US healthcare system, it has become effectively a premium payment model that pays for the majority of healthcare. And that comes with a whole host of problems, which, you know, we won't kind of go over here. But he sort of envisions that primary care really should be the quarterback of healthcare. And if we can achieve that, that'll be one of the more transformative things we can achieve. You know, I love the quote that Ankit from Pearl made, right? We've lost the hearts and minds of the physician. So it's a former CMS leader, Andy Slavitt. There's a quote from him. I thought that was a really insightful point, and that sort of recognition that maybe we need to start thinking of ways to not do that, right? And so I'm excited about the program. So looking at to address some of those changes. You know, great to hear really impressive data from Ernie, just in terms of sort of, you know, the impact primary care can have on life expectancy. That was a really interesting insight, I thought. Dr. Aimee Melchi, you know, it was really great just to hear how, you know, lifestyle medicine, her perception of lifestyle medicine, which is an advanced kind of evidence-informed comprehensive primary care, works really well within DPC. And so, you know, I love the work that Amy's doing. And she, you know, it's the best medicine she's practiced in 24 years, right? Combining lifestyle medicine with DPC. And she said it's fun, right? So we want to have fun in life. And then, of course, Dr. Ada Stewart, and you know, real honor to have her with us here today. And we're really excited by our partnership with AAFP. But just her personal story of how she, you know, as a child, she used the emergency room as a means of healthcare. I think the reality is that's a story that resonates with a lot of folks, right? Like that, you know, I've actually had to do that on occasion. And so she made it her quest and life mission to serve those that are underserved. And, you know, it's really encouraging to hear her kind of view on how we need to go from fee-for-service towards prospective payment models and models like DPC. That's a really huge endorsement for this community, coming from the head of one of the largest physician groups in the country, membership groups in the country. So, you know, really great insights there. And then, anyway, I think, you know, maybe just to summarize, I think, you know, we started Hint to help transform US healthcare. We saw an opportunity to support a community that was, they kind of figured out, okay, how do we step outside the system? It's going to and actually innovate and get something working and get it into the hands of patients, right? And it started there, and it's really scaled and grown from that point. And the thing I'm really excited about is how can we take this to the next level? How can we scale it? How can we continue to maintain the integrity of the movement while starting to take these principles of price transparency incentive alignment, low overheads and administration, restore the patient-physician relationship, and together transform healthcare. So thank you so much for attending HINT Summit 2021, and we're really excited to see you next year at our in-person summit. Thank you so much.